The FDA is considering whether to adopt a recommendation from its advisory panel to allow the compounding of so-called wellness peptides here in the U.S. National Health reporter Aaron Billups joins me now with more on what this means. These injectable peptides really being considered have grown in so much popularity lately due to these wellness influencers, you can call them. I'm seeing this all over social media. It seems like every video I'm looking at. What does this mean, and what does the science say about them?
Yeah, so first off, we've been using peptides. There are several that have been rigorously tested, already FDA approved and used broadly. One is insulin, which is used by many to help control blood sugar levels. There's also GLP-1 weight loss drugs like Ozempic and Zepbound. But now the FDA is considering whether to allow US-based compounding pharmacies to make and sell these 6 specific peptides that you see there on that list. Already bodybuilders, athletes, and just people looking to enhance their exercise results have been accessing these injectable peptides through a so-called gray market, unregulated drug manufacturers here and abroad. The drugs are purported to build muscle, help you heal faster from injuries, and improve sleep and cognition, among other potential benefits. But several documents submitted by FDA scientists show there isn't enough evidence that these peptide shots are safe and effective. There haven't been large clinical trials done to prove the drugs do what influencers claim they do.
A lot of these peptides are made in, we call them bathtub labs. There's no standards or strict regulatory oversight to making these peptides in other countries. And so a lot of people order these peptides and you literally have no idea what is in them, if they're contaminated, if they've been properly produced under clean standards, and then people just inject them into their body. And my advice to every patient, every athlete is don't be your own lab rat.
Health Secretary Robert F. Kennedy Jr. supports the use of more of these peptides and argues that allowing U.S. manufacturers to make them would immediately shift demand away from the gray markets to compounding pharmacies that adhere to strict manufacturing standards. But FDA scientists say there's still so little known about long-term side effects. There's no standard protocol for how they're made, the dosage, the solutions they're stored in, so there's still many risks.
Experts aren't saying that these are dangerous or that these may harm you. Just more research needs to be done to determine whether or not these are safe and effective.
Exactly.
Yeah. All right. Aaron Billups, thanks so much.